recording. Okay, this is Noah. He is a well-developed 12-year-old boy, and Noah is going to be my patient today. And we're going to do a examination examining his chest and lungs, the cardiovascular system, and his abdomen. So first of all, Noah, I just want to take a quick look at your fingernails and just take a note there. The angle looks good. He doesn't look to be chronically hypoxic, and his hair seems in good condition, and his skin is in good condition and appropriate for his ethnicity. So as we start, Noah, what I want to do first is just tell the camera that I've already counted your respirations and that you are breathing at a rate of about 16 respirations per minute. And we counted that for half a minute while I sat over there and timed you breathing. In most cases in the clinical setting, you wouldn't want to let your patient know that you're doing that, but under the circumstances, that's what we've done here today. And his rate is, his rhythm is normal, and he's breathing with good effort. To start with, I'm also going to just take a look at Noah's thoracic cage. I'm going to start here in the back. Noah, if you could just sit erect, I'm going to look here. All right, Noah, in the posterior, Noah's thoracic cage seems symmetrical. Can you draw a deep breath in and out? I'm palpating his back. The muscles back here are symmetric and developed. I'm just going to put my hands down your sides, Noah, and feel the angle of your ribs. Noah's rib angles are descending at about 45 degrees. And his breathing is symmetric. Also, his scapula are symmetrical as well. Okay, very good, Noah. I'm just going to look at your thoracic cage here from the front. Can you draw a deep breath in once more? In and out. Okay, his breath, as he's breathing, I can see his chest coming up and doing so symmetrically. Can you do that one more time? Okay, very good. All right. So just a visual inspection with a bit of palpation. Noah's thoracic cage seems in normal parameters there. Also, as I look at the width here of his chest, it is about half of the dimension of his thoracic cage side to side. So the ratio is normal and good. All right, I think I've done what I needed to with the thoracic cage. Next, I want to listen to your breathing, Noah. So we're going to do 6 locations on your front, and as I move and on your back as well. And as I move my stethoscope from one place to the next, if you could just take a deep breath for me so I can hear you breathing. We're going to start right here. Go ahead. Good. I didn't mean to tickle you there.
Yeah.
Noah's being a great patient. Sounds good. I'm going to chest your back. One more. Hit me on the side one more time. I'm hearing vesicular breath sounds all around. Noah's breaths are nice and clear. All right. Let's take a look at something called echophony here. This is a test to see if you are consolidated, which I don't expect because of the clear breath sounds I've already heard. But for sake of demonstration, I'm going to go ahead and have you say the vowel sound E, all right? E, as I listen, okay? And if that sound, as I listen on your back, changes to a different vowel sound, the sound A, then that could be an indication that you have consolidation. Okay, go ahead and say E.
E.
Again.
E.
Again.
E.
Again.
E. 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 E.
All right. So those vowel sounds still sound like E, and so we're going to say that that test makes it seem as though you have no consolidation there. Next, what I want to do is percuss the lung fields. So Noah, would you do me a favor and just lie back on the table flat? Okay. excuse me, I'm going to tap on your chest here a little bit and just listen. You can breathe normal. Take a deep breath. One more. So I was noting the resonance changing in these lower fields. I wanted to make sure the lungs were filled before hearing those. But you can hear a resonance here. Okay, Noah, good. Can you sit up for me? Did that tickle a bit?
Yeah.
All right, I'm just going to do the same thing on your back here, so bear with me. You can breathe. Okay, that's percussing those lung fields to listen for resonance. Okay, all right, next what I want to do is move on to the heart to examine the sounds of your heart. Before I do that, I'm going to point out that we can find Noah's apical pulse simply by going down to the fifth intercostal space. So we start up here, find the notch, move down here, find that second rib off of this landmark. Okay, hold it. Yeah, body mark. Okay, right here. Okay, second intercostal, third, fourth, fifth, and on the midclavicular line, it's going to be right about here, I should expect to feel Noah's apical pulse. Even through Noah's t-shirt, I can do a pretty good job of feeling this. Yeah, I got it right now on my index, the pad of my index finger. I have already counted Noah's apical pulse before the video started, and we calculated, I did it for 15 seconds and got him at 17 beats, times 4 is 68 beats per minute of an apical pulse. But what I want to do though is go ahead and listen to your heartbeat in some various locations here on your chest. I'm going to start on this side, Noah. I'm going to have you hold your breath just for a moment. Okay, you can breathe. I have S1 and S2 in that position. S1 and S2 in the pulmonic. S1 and S2 again. S1 and S2, and now in the apical, I have S1 and S2 in all of those locations. Also don't hear any evidence of splitting of that sound. The rhythm is fairly regular. Some irregularity is noted perhaps from the patient's nervousness or also from holding his breath. There's a little bit of change in the rate. But otherwise, I think Noah has a good rate and normal rhythm. Okay, the last thing I want to look at is your abdomen. We're going to check out a few things, Noah. I want to look at your palpating the area of your liver, your spleen, and kidneys, and then just generally doing a palpation of your abdomen. If you could just lie back on the table for me once more. Noah's been an excellent patient. This tends to get a little ticklish for my patient, so you'll have to bear with us if that happens. Okay, so Noah, what I'm first going to try is just I'm going to move my hand around and just press lightly with the pads of my fingers. I want you to let me know if you experience any pain. And I'm going to be feeling for any masses that might be there, just light touches, okay? Just light touches. Just little touches. Noah's tensing up his belly right now. That's there, it got relaxed, good. Okay, I'm just going to move it, keeping my fingers in contact with you. You have any tenderness? Any pain? No? You did very well. Okay, Noah's not reporting any pain. I'm not feeling any masses on that light touch. We're going to try a little deeper palpation. Again, we're feeling for masses, but we also want to know if Noah's, again, experiencing any pain. For some people, you can actually palpate the aorta while doing this, and for slender people, that is true. I know for my daughter, I can. Noah might be a little too tense for me to do that, but we're going to go ahead and try a little deeper palpation now, and I'm just going to, when you exhale, I'll just push in, okay? Okay, good. Good. Any pain? No pain? Okay. Good.
When you pushed hard.
When I pushed down, you felt a little pain in this position?
No, like when you pushed too hard, I think.
If I push too hard, you can experience some discomfort. Okay. Exhale again, and let me just press as you do. Okay. A couple more. It's okay. You're doing a great job. Okay? You're fine. Okay, very good, Noah. All right. That was our deep palpation. Next, what I want to do is, in doing the dry run, I wasn't successful at feeling the organs, the kidneys, the liver, the spleen, but I do want to try to demonstrate the technique that would be used in doing that. So for the liver, we're going to palpate, Noah, if you can move your arm down there, thank you, buddy. Okay, the liver is right here on your right side. It's hiding just behind the ribs here and may descend just below the ribs a little bit. So what I'm going to ask, as we practice this, the practitioner is actually responsible for doing some lifting of the rib cage here, but Noah felt more comfortable doing that himself, and I'm willing to let him do that again if you'd like. You want to do it yourself, or do you want me to try? You want me to try? Okay. So what I'm going to do is just put my fingers here under his ribs. I'm going to lift as he exhales, and then I'm going to press down with my right hand under the costal margin, and we'll see if I can detect any of the liver here, any of its contour, all right? So Noah, if you can just take a couple of, you can breathe deeply, and I'm going to do this while you're breathing, okay? Let's try it with an exhale. That might work best. I can't tell where your ribs are. Relax. I feel ab muscles and rib cage, and I don't know where the difference is. So just try to relax your belly. I know. We'll do the best we can. You want to do it? You want to put your fingers there and curl under it yourself?
Sure.
Okay. Exhale. And I might actually be able to feel a border of the liver at this point. Okay, good job, Noah. We're going to move to the other side. What we're going to do on Noah's left side is we're going to feel for his spleen in a similar way that we did for his liver, with the lift of the ribs. And at the same, in a second breath, I'll move my hand slightly down, and we will attempt to palpate his left kidney. So we'll start with the spleen. You can do that again if you want to. I'm going to reach behind you this time. Yeah, this is this one. Okay, so on exhale. Okay, one more time. I'm using my left hand on the back here. Was that the CV angle? And feeling, good job, Noah. I think actually I'm feeling a little contour of something there. All right, moving my left hand down, I'm going to bring up his left flank while I press on his abdomen to see if we can palpate his left kidney. Okay, whenever you're ready, Noah. Exhale. I'm lifting. Okay, try one more time. I need to get over to your left side a bit more. Can you do that one more time? Good. Again, I'm feeling a little something, but my uneducated hands may not understand exactly the organs that I'm feeling there. Okay, so that took care of the left kidney. Stay down. I'm going to move to his other side so we can do the same for his right kidney. All right? Whenever you're ready, you let me know.
Okay.
You think so? Okay, I'm going to use my right hand. I'm going to reach around to lift the right flank and use my left hand to palpate for his right kidney. No, whenever you're ready, I'll lift and you exhale. You say when you draw a deep breath and exhale. Well done. Yeah, very good. And you can sit up now, Noah. Okay, that concludes our examination of Noah. He's been an excellent patient. Thank you very much.